One of the things that I get asked to do often with ears is to repair a split earlobe. And I think there's a lot of myths around why people get split earlobes. Most commonly, it's attributed to wearing heavy earrings, or perhaps wearing a hoop earring that got caught on a phone or something and caused a split earlobe. But it's my appreciation of doing many split earlobes through the years that what we're dealing with is a metal allergy. And let me explain that a little bit. So what happens is we pierce an ear, and then we put this so-called surgical stainless or platinum or hypoallergenic post in there. But the reality is that there is a metal allergy that occurs. And unless you're using 18 or 22 karat gold, that's the most hypoallergenic metal you can use, you're exposing this potential of allergy. And what happens is that the post interacts with the skin in the hole that the post is in, and it breaks down. And the complaint is often the same. They will get some drainage from their ear, and it's a little bit of pain associated with it. And then once that skin breaks down, that post can be light as a feather, but its interaction with fat causes it to go through as if it was a hot knife through butter. And it'll slowly work its way through the earlobe so that it heals above, opens below, heals above, opens below, and eventually you get a split in that earlobe. Often people will come and the earring has almost worked its way out. They said, my gosh, when they pierced the hole, it was much higher, and now it's worked its way down to the edge where it's about to come out, and that's because of this phenomenon. And I see it with light earrings, and I have patients who I've done this procedure where we've closed the opening and re-pierced it for them 3 times. And each time they go out, they start with an 18 karat gold post, they get a certain comfort level, it doesn't hurt, it doesn't drain anymore, and they go back to their box of costume jewelry, silver, whatnot, and the cycle starts again. I think this is something that I've come to appreciate over the years of doing split earlobes, and I think my most successful and happy patients are the ones that listen to me and go out and get it's nice to get new earrings and either take an 18 karat gold post and attach it to an earring of lesser value, or just use our higher grade material. But this is a solvable problem with a simple solution.